Hello, and thank you everybody for coming to today's event, Stay Home, Save Lives, Dangerous Times for Domestic Abuse Survivors. It's really great to see such a huge turnout, and we're really grateful for your support and your interest. We've got a fabulous line out, and I'll introduce you to them all and give you an outline of today's event in a few moments. But I just want to check in with you all first and to remind you that this is a very difficult topic, and many of you might struggle with what's going to be said today. So can I ask that you all keep yourselves and each other safe? So if you have a comment to make or a question to ask, that you think about the way you say it or ask it. And also if there's something that's upsetting you or triggers something in you, then keep yourselves safe. I think it's fair to say that today's topic probably isn't suitable for children. So if you're juggling childcare and coming to the seminar, just to bear that in mind. I think Neil already said we are recording today's event, but your face won't be seen or anything like that. But we'll send you a reminder closer to the time, send you a link to the webinar sometime next week. So Neil's gone through the housekeeping in relation to the webinar. So it really just leaves me to introduce you to all the fabulous guests that we have today. And so kicking off, we've got Dr. Chris McGill, who's a senior lecturer in the criminology department at London South Bank University. And she's also in the lead for the Crime and Justice Research Group. So Chris is going to be talking today and reflecting on national and international statistics around from the police and domestic abuse services to tell us to see what that can tell us about domestic abuse. Then we'll be moving on to Alistair, and Alistair Sherlock is Accreditation Manager for Respect and works with an organisation called Respect, who works with perpetrators, male victims and young people using violence in close relationships. So, for example, child-to-parent abuse. His role focuses on quality assurance and supporting the development in practice. His background, like mine, is in the probation service, and he gained a lot of experience there managing the programme for perpetrators called Drive. After Alistair, we'll have Lyndsey, Dearlove from UK Says No More, and she'll be talking about the national response to domestic abuse during COVID-19, including the Safe Space scheme. I'm sure you know that that's the programme that was done by UK Says No More with various pharmacies to help keep people safe. And finally, I'm delighted to introduce you to Rose Lewis from Sister Space, an organisation that works with women and girls from African heritage who have experienced domestic and sexual abuse. Rose is here today to talk about her work with these marginalised groups. So without further ado, I'll hand you over to Christine, who can talk to us about the national and international picture. Thank you, Christine.
Okay. Thank you, Tyrion. I'm going to talk about the data that's available on domestic abuse and COVID-19. And really, it's just some reflections on what's out there and what it can tell us about domestic abuse and how it changed under COVID-19 lockdown. For some of us, COVID-19 and the government's advice to stay home to suppress the spread of the virus has increased risk in relation to another life-threatening concern, and that's domestic abuse. I'm going to be drawing on data from various sources, official data such as from the police, reports from organisations supporting domestic abuse survivors, as well as some of the reports and the data that flowed through the media in early April. I'm focusing on England and Wales or the UK. However, I have pulled together some data from other countries towards the end, and the figures mostly relate to those weeks between the end of March and mid-May, which corresponds to full lockdown in this country. So let's begin by looking at the official data. As a criminologist, I'm inevitably drawn to the criminal justice system and to what it can tell us about domestic abuse. And in this instance, I'm thinking particularly about the police. I'm also aware, however, of the huge caveats that we must place on police data. So, for example, domestic abuse is and continues to be an underreported crime. And also there's the focus on violence and the focus on measuring on an incident basis that impedes capturing those more hidden forms of domestic abuse, such as coercive control. Having said that, in terms of building an evidence base, an informed picture of domestic abuse under lockdown, I think every little bit helps. So let's have a look at what the data tells us, what the official data tells us about domestic abuse under lockdown. First port of call, we look to the official data that flows from government, that flows from the Office of National Statistics, particularly police recorded crime and the crime survey for England and Wales. Now, although ONS have published a special update on crime under lockdown, domestic abuse doesn't feature. Now, it doesn't feature for good reason, actually, because there were safeguarding issues around the methodology adopted. But the good news is that ONS have stated that they have plans to publish an article later on in the year. And this article will bring together their data on domestic abuse and also data from victim services. And they're going to publish that in one publication. So in terms of government and official data, it's a question of wait and see. But currently there's little to be learnt there in relation to sort of official national statistics. There's a little bit available on a sort of local level, that police force level. But then again, the picture here is a little bit mixed. The information I've gleaned here is actually from a BBC Freedom of Information request. And it found that, I say mixed because around half of the police forces that responded to the FOI request indicated that domestic abuse calls increased, whereas the other half indicated that domestic abuse calls had decreased. And I suspect this reflects police recording and reporting behaviour more than anything else. It tells us really very little about changes in domestic abuse under lockdown. What's a little bit more promising, I think, is a piece of analysis that the Metropolitan Police have recently published. And I'm just going to share with you 3 points from that analysis. The first point was the Met reported that since lockdown, the volume of domestic abuse calls have increased compared to the same period last year, round about 11% increase. And the second point concerns the types of caller, which is interesting. And all this increase, the increase in calls, actually comes from third-party callers, so neighbours, etc. Now, we could speculate a little bit about this. We could speculate along the lines of this possibly reflects the noise because people are at home a bit more. It could reflect an increased awareness amongst the general public due to the media reports that were hitting the press round about that time. Or it could reflect an underreporting on behalf of victims who are now locked down with the abuser. Or indeed, it's a combination of all three. A third point from the Metropolitan analysis, which I thought was interesting, concerns crime. So that's recorded crime rather than call-outs, domestic abuse crimes. And it concerns the nature of the relationship between the survivor and the abuser. Abuse by ex-partners fell by 9%, according to meta-analysis. Abuse by current partners and family members, on the other hand, increased significantly. On one hand, this makes perfect sense. Physical distance imposed by lockdown between ex-partners negates domestic abuse. But I'd argue that this interrupts only physical domestic abuse, perhaps, not necessarily other forms of abuse. For example, those perpetrated via other means, perhaps technology. So just to bring this section to a close, police data currently raises more questions than answers. But as I said at the outset, it has its place. It contributes to the overall picture of changes in domestic abuse under lockdown. But we need to be critical with this data. We need to adopt a critical approach and question it wherever we can from a position of our expertise on this issue. And we need to do this because quite often it's police data, it's official data that feeds into policy and practice around domestic abuse. Moving on now to look at the data from a different perspective, turning our attention towards reports from organisations supporting domestic abuse survivors. There's much more in the way of data emanating from this particular source. If you remember, not long after full lockdown was implemented, domestic violence and abuse suddenly became very newsworthy. And that was interesting. We should always be aware about the way the media often frames domestic abuse and challenge those occasions where it falls into victim blaming, or indeed where it falls into pandemic blaming. What the data behind the stories illustrated was the perfect storm facing services supporting those at risk from or experiencing domestic abuse. And this is not my analogy. This is one that I borrowed from a Women's Aid and their recent report on the impact of COVID-19 on domestic abuse survivors and services. It's one of the few reports that attempts to bring together the data in this area. It's very recently published and it's filling a gap actually, and other organisations have done the same. There's some fantastic reports out there that brings together some of the data and the statistics in this area. Focusing on Women's Aid reports, its top line, really, if you like, is that domestic abuse has worsened, and this includes for child survivors. 2/3 of the women survivors experiencing abuse reported that the abuser had started using lockdown or the virus and its consequences as part of the abuse. And women in Women's Aid research reported that the abuse they experienced got worse during the pandemic. And this finding was especially true for those women living with the abuser. Similarly, in relation to children, survivors with children who were currently experiencing domestic abuse reported that their children had witnessed more abuse towards them. And over 1/3 said their abuser had shown an increase in abusive behaviour directed towards their children. So this fills some of the gaps in relation to police data. It tells us something about the changes in domestic abuse under COVID-19 lockdown. The Women's Aid report includes some other really interesting and relevant findings around the increase in demand on services and the expected increase in the future, about the impact on refuge spaces and also the funding challenges, and how the crisis, COVID-19, has resulted in organisations having to work in new ways, often at quite short notice, and the challenges there. It's also highlighted the importance of the community in relation to domestic abuse. Where I think there's a gap in the data from organisations supporting domestic abuse is in relation to those perhaps smaller, more local-based organisations who are sort of grassroots supporting particular communities on the ground, and what their experiences are. I'll give you one example. Karma Nirvana, an organisation supporting victims of honour-based violence and forced marriage, reported that their clients, Black and minority ethnic victims, were more reluctant to leave during lockdown due to the disproportionate impact of COVID-19 on Black and Asian minority ethnic communities. So that's interesting, and I think there's more to be learned. There's more data to be found in relation to those organisations supporting survivors on a more grassroots level and the particular challenges there. Finally, I'm just going to touch on some of the international evidence. There is international data out there. It's patchy. Inevitably, it reflects those countries that have and are able to invest in effective reporting systems. And that's important to bear in mind. In the same way we have a partial picture in relation to police data, we have a partial picture in relation to reports from organisations supporting domestic abuse survivors. We have a partial picture in relation to globally how COVID-19 has impacted on domestic abuse, has changed domestic abuse. I've listed some of the countries here that have been reported in the media around changes and increases in risks relating to domestic abuse. China, for example, the first country to impose a national lockdown, police saw domestic abuse incidents triple in February compared to the same month in 2019. And as the virus moved across Europe, we saw similar reports emanating from countries, European countries, for example, France, who reported a risk in domestic abuse incidents by somewhere in and around a third. So we are not alone in this phenomenon and this change in domestic abuse and the increase in risks to women and children experiencing domestic abuse. What's more interesting and where more could be learned, I think, is in relation to the different interventions and approaches that other countries have taken in the face of the crisis and providing services to women and children experiencing or at risk of domestic abuse. And that's an area that's worth exploring, I think. Just to bring my presentation to a close, what I've done here, hopefully, is illustrated how data and lockdown measures during COVID have increased the risk for people in abusive relationships. What I've also hope I've achieved is illustrate that there's some gaps here and there's some more work that needs to be done. And this is especially important, I think, as we enter into a phase of local restrictions, thinking about those local organisations, and not to mention the prospect of a possible further full lockdown. This remains an incredibly important issue, and it's one that we need to continue to draw attention to. And on that note, can I just say a quick thank you for our attendees for listening, and also to a fabulous student of mine, Megan, who may be listening, who was incredibly helpful in putting together some of this data for me. So thank you. And I will hand back to Tyrion.
Okay, thank you so much, Chris, for the clarification behind the statistics outside of the media reporting and for analysing what's really going on behind the headlines. I think it's very interesting to hear how domestic abuse has increased and your thoughts behind the reasons why that may be. And particularly thank you for focusing our thoughts for future action. Thank you. That was excellent. I really enjoyed it. And so now moving on to Alistair. So you'll remember that Alistair is from Respect, and he's now going to talk to us about the male perspective in COVID-19.
Good afternoon, everyone. Thank you very much for taking the time out today to join us on the webinar. So as Tyrion said, my name is Alistair Sherlock. I'm the Accreditation Manager for Respect. It's probably just worth just giving a little bit of an overview in terms of actually what Respect does as an organisation. So as you might have seen there in the chat, we have the advice lines. So we have the men's advice line and our general helplines number, and that's one of the things that we're sort of best known for. Predominantly, Respect is also a membership organisation. So we have organisation and individual members across the DA sector who are predominantly focused on working with perpetrators. And then there's another stream of, there are various work streams that Respect are involved in, but one of those is quality assurance, and that's part of my role, alongside other initiatives such as Drive, Make a Change, which is a partnership with Women's Aid, and Change That Lasts, again a partnership with Welsh Women's Aid. So what have Respect been doing during the COVID-19 pandemic? So we've been responsible and issued guidance and support for services. So on our website, we've got some guidance and support for practitioners and for services. So that's thinking very much about you know, having clients who've gone through, you know, since March, have gone through monumental changes in their home and living situation, that's obviously going to impact really significantly on their coping mechanisms, their use of abuse, control, and coercion, and thinking very much about survivors and what's that experience. So we've tried to be really forward-thinking in supporting not only our member services but also other organisations that are working with perpetrators about being really forward-thinking and really bringing that risk management piece really central to what they're doing, and thinking about that impact on survivors and how we can build and enhance space for action, which undoubtedly during this period has really been impacted. We've undertaken a lot of advocacy on behalf of the DA sector, liaising with government and the Home Office. We're involved in a number of other calls with sector partners like Women's Aid and Safe Lives. We've used some of that advocacy to secure funding, and that's allowed us to increase our capacity on the helpline and also the men's advice line, and we've seen significant increases in terms of the number of callers to those lines, and we also utilise some web chat functions and have the capacity to respond to emails, and across the piece, the demand for support has increased quite significantly, in line with other helplines, national helplines that are working in this sector. We've undertaken surveys and reported on changes in the domestic abuse sector. We've been through periods of producing a sort of one-page sector update periodically through the pandemic, just to identify the impact on changes for services, for practitioners and for clients, and that's very much what I'll be building on today. And we've increased our engagement with our accredited members, holding frequent discussion forums, looking to create a shared space to learn, to consider best practice, and really what are a lot of evolving processes as we move through this pandemic, and the impact it's having at different phases, from when we first found ourselves in this situation in, I suppose, moving into it in early March, and where we were in April, thinking all the way through to our present day, and how that's impacting on service provision. So what's the impact on organisations been? So I think one of the starting points has been increased costs. Almost overnight, group work ceased. I think within the space of about a fortnight, across the country, organisations that were delivering group work, face-to-face interventions, moved to one-to-one work. And that one-to-one work has been done largely initially by phone, but then increasingly via video calling. So thinking about Zoom, Teams, Skype, maybe over WhatsApp. But it doesn't take a particularly learned person in with a financial brain to work out that the increased cost in delivering one-to-one interventions, one client for 1 hour, as opposed to having 10 to 12 clients in a group, for example, over 2.5 hours, is going to radically increase your service delivery costs. The capacity to manage increasing levels of referrals. What we saw initially was actually a drop in referrals. Very quickly that changed. Very quickly, organisations began to introduce a triaging approach. So there was a lot of concern from a safety perspective of undertaking behaviour change work with perpetrators of domestic abuse or those who harm. And so for clients who hadn't previously been engaged in a group work intervention where there was that level of knowledge of the client, the work for those new referrals was very much focused on risk management. Services to support their staff members have increased almost across all services that we are aware of. Increase the frequency of clinical supervision and practice or treatment management for for their practitioners. It's the frontline practitioners, I think, that have probably experienced some of the greatest change in this period, and we'll move on to think a little bit about some of the impact on them in a minute. As we move back into some level of face-to-face service provision, what we're seeing is the increased costs through venue hire. So with our social distancing guidelines that have been issued by the government, it's no longer particularly feasible to have 10 to 12 clients in a room together, plus the 2 facilitators. So organisations are running smaller groups and often having to hire larger venues, community venues, to be able to facilitate that. And of course, there's the added costs of PPE. On a weekly basis, these might all seem like small things, but actually when we consider that this is probably a long-term future, these costs will mount. And I think the question is raised as to where the additional money will come into the sector to support the additional needs. And the other thing is the IT infrastructure. So we've now got a lot of practitioners working from home. There's been an increase in practitioners being issued with laptops and tablets to be able to facilitate face-to-face sessions, and that all comes at a cost. And we can couple that with, probably for those who work in the sector, financial uncertainty is something that is certainly isn't new, but we know that furlough and redundancy is something that organisations have utilised and are having to consider. Approximately a third of our accredited services actually furloughed staff, with one organisation furloughing up to 70% of its frontline practitioners initially, as their variable income from self-referrals dried up almost overnight. There's an impact on contracts and the deliverable outcomes, and the ability to work through the required volumes for contracts being a concern, in the context of the fact that obviously the pressures on practitioners to pick up now what is a one-to-one as opposed to a predominantly group work caseload has taken its toll, and that then requires additional hours. There are a number of services who've been fortunate enough to secure short-term funding to do it, but have had to actually employ additional members of staff during this time to deal with the increased workload through the one-to-one delivery, but also the ongoing increase in waiting lists and referrals coming from other services. So, thinking a little bit about the impact on practitioners. So we've got a lot of practitioners now who are home working. The majority are still not back in an office environment. And that's coupled with the next point, which is about potential isolation and inviting perpetrators into your home. So I think this was something that was very much probably not considered so much initially, but very quickly our discussion with services, and then also tapping into some of our networks in North America particularly, focused on actually practitioners having an appropriate space, because we were requiring our clients and the perpetrators on programs to have an appropriate space to undertake remote sessions. But actually we also have to think that not all of our practitioners in service have an office room set up at home, and it might well be that the place where they're having to deliver the sessions that gives them the best Wi-Fi signal, for example, is in the front room of the home, or is it in a child's bedroom? So, you know, they're also having to take steps to think, well, actually, I need to make this space safe and appropriate for me to do this work, and that might impact on family, being able to, you know, not being able to use certain rooms in the home, and things like that. I think there's also a lot of pressure on individuals that are suddenly working in isolation. So if you've spent most of your time sat in an office, you come out of a really difficult session with someone, you're able to debrief, you're able to have that peer support. You might be able to engage with a manager. The capacity to do that is somewhat impacted. You know, we don't have those colleagues that are immediately around us that we lean on, who provides kind of support, direction, guidance, and many other sort of soft skill levels of support. And I think that's something that shouldn't really be forgotten, because the you know, the practitioners are the ones that make these interventions work. They're the ones that make these interventions happen for clients. And so the impact on them is really significant. They've experienced an increasing workload, and you know, there's also that additional pressure through the additional assessments and service delivery that they're having to undertake, all amongst the pressure for many for a period of time, certainly of furlough, and what that might have meant for them on an individual basis. So I just want to think for a minute about then, obviously, the impact on clients. I focus very much, I suppose, on organisations and practitioners. But it's the clients who are obviously central to everything that we do. I think as has been identified by our previous speaker, you know, isolation and risk for domestic abuse survivors and victims at this time is really acute. We currently probably only know, you know, part of the picture. Whilst we're particularly impacted now with maybe not a national lockdown, but regional lockdowns, the ability of individuals to coerce and control survivors and victims, to monitor their whereabouts, is a really significant challenge. And the scope to do it now is possibly greater than ever. And I think we're really mindful as an organisation working alongside sector partners that this is only going to feed into those really significant increases in domestic abuse that we're already aware of. There are complications over child contact, and we see that through some of our family court cases. The family courts are also backed up with referrals waiting to go back to providers. We've got impacts of police bail, so people aren't appearing in court. Those criminal charges are not necessarily being progressed in as timely manner as normal. And that's leaving people on bail with limited bail conditions for extended periods of time. And these are all areas that we're concerned that are going to impact on risk for survivors and victims, and really centrally for safeguarding for children and children's well-being. I think the other thing that we can consider, and I think probably I would be as guilty as anyone for for having, I suppose, a greater level of confidence in, is that there's also an impact for lack of access to services for those who are seeking help, or those who've been identified as needing help. Organisations have quite extensive waiting lists, as I've already touched on. I'm aware of one service in the south of England who reckons that it would take them as much as 3 months to actually get to grips with the waiting list, and it implemented a triaging system to be able to address the highest risk and prioritise. But nevertheless, for an individual who's sat with a referral waiting to be assessed, the access to support could be, unfortunately, could be some time away. And I think it's easy to take for granted in the days where we're all sat here, you know, with laptops and tablets and what have you. But there are a great many people who still don't have access to technology to engage in these online video calls and interventions, that might not have data packages on their SIM cards, might not have Wi-Fi in the home. And these are things that for organisations who are delivering services and are utilising the online platforms, might actually become barriers for clients who harm to be able to engage with, and also, but also for survivors in terms of being able to engage with a whole range of victim services and groups which have been transitioned to be delivered online. I would just share that one of the comments that we had that came from colleagues in America was that we've spoken a lot about perpetrators having a suitable space, quiet space, to be able to engage in a one-to-one intervention or a small group online. And for a number who didn't have access to Wi-Fi, there were services reporting that they had clients who were sitting in their cars in the car parks of fast food restaurants, and accessing the Wi-Fi that was available there. And I think there's been some really interesting individual stories and narratives that have come out of this period in terms of actually reflecting the level of motivation people might have in terms of engaging with those interventions and thinking outside the box in terms of how they can access a Wi-Fi signal. That's just, as I say, a sort of short overview in terms of some of the impact. Obviously, there are a great many impacts felt by individual survivors and victims, and I think it's just the increasing awareness that we have of keeping survivors central to our interventions whilst working with those who harm has been really key for us during this period and for our member services. So I'll pass back to Tyrion. I'd just like to say thank you very much for joining us.
Thank you so much, Alistair. It was really very interesting to hear about the depth and the breadth of the experiences of Respect. I think it's really interesting to hear how you manage the risk of perpetrators that you know who are living in lockdown, but also getting to know new perpetrators or new clients, and then sort of having to juggle all of that with the practicalities of doing things online. A cracking job. Well done. So now I'm going to move on to Lyndsey. Lyndsey Dearlove is one of the founder members of UK Says No More. And Lyndsey is going to talk to us about the Safe Space project. Thank you, Lyndsey.
Sorry about that. Thank you so much for inviting me to take part. It's an absolute honour and a privilege to be with such incredible panel members. So I'm really, really grateful. So a little bit of background. I head up UK Says No More, which is the national campaign around the prevention and awareness raising of domestic abuse and sexual violence. And it's delivered by London-based or South East UK-based charity Hestia. Hestia is a charity that provides support around domestic abuse in a number of different ways, one of them being operational delivery. So we provide support with regards to accommodation-based services and refuges for women and children. We have a number of independent domestic abuse advocacy services. We provide merit coordination. And as well as that, we launched the Bright Sky app, which is the free to download app available through Google and Apple stores, which provides support to both those who are enduring domestic abuse, but also for the friends, family members and colleagues who may be concerned. We also have the Everyone's Business program, which is a national program that we deliver in providing support to employers to enable them to create and respond to domestic abuse within their employee network. But here I'm going to talk today a lot about our Safe Spaces program, which for us from UK Says No More was a really important moment. We knew, for example, when the government announced in March that to stay home is to stay safe, that for many of those enduring domestic abuse, it didn't mean staying safe. What it meant was that for those who had already been enduring domestic abuse, that abuse would escalate and that the opportunities to access support through day-to-day activities would absolutely decrease. We knew that monitoring and how the perpetrator would monitor that person would be increased, both through technology, but also through physical means. We also knew that those that hadn't yet experienced physical abuse or that had started to experience abuse, that abuse would escalate. And there would be a forced experience of not knowing that services were available. We also had the assumption that for many people who were concerned, who wanted to access help, may have actually thought that the services weren't available. And if you had been presented with COVID-19 symptoms, that you wouldn't be able to access support. So quite early on, our objective as a campaign was, who can we work with and how can we work with people in the community to create a response? How do we enable that message to be created so that people were aware that services were available, but also that there was opportunities and means to do so? In the early stages of lockdown, the government was really clear. You were able to sort of go outside for a little bit of exercise and you were able to do essential shopping. And the two types of shops that were still open were your supermarkets, or the ones that create and produce food, but also pharmacies. And so we quite quickly were able to link in with both the National Pharmaceutical Society and the Royal Pharmaceutical Society to put together a program called Safe Spaces. We had piloted it in Islington in the November of last year, looking at high street businesses which could provide a space where somebody who was enduring domestic abuse could pop in at their own time, be self-guided and have that quiet moment, either in a separate meeting room to access support. So what we were able to do with a number of different pharmacies, such as Boots, SUPERDRUG and Morrison's, was launch a national program where their pharmacists opened up the consultancy rooms to provide this safe space. And what was in the safe space were posters, direct access to the national domestic abuse helplines in all 4 nations, as well as the men's advice line, and access to the Bright Sky app, which provides local domestic abuse service directory. And I think a key thing that we learned from that was, you know, 10 years ago, 15 years ago, all of us would be walking down the street and we would see a phone box. And that phone box in many ways was easy to access. You would pop in your 10p if it was in the early 90s, 30p a bit later on, and probably 70p just before they all disappeared. But what it did do is give you an opportunity to speak to somebody without being monitored. It wasn't unusual for someone to be in the phone box, and it also wasn't usual to see people hanging around the outside of that phone box when those calls were being made. But since we all now have moved to having mobile phones, which can be monitored, can be mirrored, we don't have the same ability to have those independent phone calls. So there was a key thing for us was, how can we enable safe spaces to exist in the community so that those people that were enduring domestic abuse and could leave the house to do an essential shopping run or go to the pharmacy would be able to go in on their own accord and use that space to contact specialist support services. So all in all, we have just over 3,500 pharmacies that join the program. And like I mentioned, with Boots, SUPERDRUG and Morrison's coming on board, we worked in partnership with them and the independent pharmacies to create a national campaign through media. Firstly, to let people know that services were open and available, and that if you were presented with COVID-19 symptoms, you could still access support. For example, through our Bright Sky app, and like Alistair's mentioned, there was a slight change in how referrals were coming through to different helplines. But what we saw quite early on was that there was an increase of over 47% in the downloads to Bright Sky, and that the usage of that app slightly changed, meaning that if somebody felt it was safe to use the app, they were able to then access that in their own time and accord. So we have some information about how the safe space was used directly from pharmacists themselves, but also from people who used the service. So what we could see and what we could understand is that the victim's journey, or those that are enduring domestic abuse, will act in different ways. In the first instance, they will do what they understand is safe for them. And I think it's something that we really need to really be aware of all of us who are working in the sector, is that the victim or the person who's enduring domestic abuse knows the perpetrator's behaviour. They understand and know when it is safe to do something and how they can access support. So for example, prior to lockdown, lots of people who were in experience of coercive and controlling behaviour would use opportunities like when they dropped the children at school, when they went to a hospital appointment or a doctor's appointment, to take 10 minutes afterwards to make that crucial phone call. But during lockdown, with every moment being monitored and every time you're leaving the house you could be questioned, these opportunities decreased dramatically. So we also saw that victims or those enduring domestic abuse may go in and understand what information is available, what type of support is available first off, and then create a safety plan in their own accord about how they access that support. Sometimes it's a case of making a number of phone calls to a domestic abuse helpline. Sometimes it's linking in with a specialist support service. But in many instances, it's making that contact with friends or family members whom they haven't been able to speak to. So one of the key things for us with regards to the safe spaces was to provide that opportunity. One person contacted us who had used the service and said that she had waited until she was not able to, she was not shielding any longer, found information about a safe space via the Boots website, and then found her local safe space in the pharmacy. And then on her trip to go and get her medication, had her first contact with her family in a number of months, contacted a solicitor, created a safe way in order to leave that property or to remove the abuser from the property, and now is living free from abuse. And I think the key in that moment is that she needed the time to be able to engage with that support, the time where it was unmonitored and she felt safe and comfortable to make those calls and understand. And there's a couple of things that we've learned from lockdown in relation to our other pieces of work around our Everyone's Business program. Quite early on, we recognized that it was great for many people. Employers were telling us all to work from home, and we were quite excited that we weren't going to do the commute and it was going to be incredible. But actually, it poses a whole new dimension of control. For those people who are enduring domestic abuse, work was often seen as a safe place, an opportunity to leave the home, potentially access support, but also that there's a break in what they were enduring. When we are saying to, employers are saying work from home now, it works great, it's also about decreasing those opportunities to ask for help. So we worked alongside all of our employees through Everyone's Business program to create a believe, respond and refer model. And that was very much focused on increasing the pathways to support. As an employer, you potentially have an unmonitored communication source where you can directly communicate with your staff team, letting them know that services are available, but also what types of services are available. In addition to that, you can have opportunities to raise a white flag or to contact a domestic abuse champion and ask directly for help, with a clear request from the employer to be that bridge to those specialist support services, not to take the place of specialist support services, but to be that bridge to it, to enable somebody to access it. So for many of the domestic abuse providers, you know, we've started to look at different ways that we communicate. Women's Aid, for example, offer a live chat. You can contact our IDFA services directly via email now. And if you're using your work or your employer's email address, that creates a space where you potentially are not being monitored by your abusive partner. So there's a couple of things that we've thought about going forward. We know, for example, that Safe Spaces will continue over the next 6 months into the next year. We've got more pharmacies who are joining. And I think one of the key things that we've seen is, as lockdown measures slowly decreased, the need for safe spaces didn't. We saw some of our safe spaces, such as Boots, Morrison's and SUPERDRUG, coming forward and saying that even their own employees have started to use the space to access support, which again increases those opportunities for support. Also, the thing is that what we recognize is that for many people, accessing domestic abuse services or knowing how to access them can be very, very difficult. You know, just as Alistair said, the access to online support sometimes is very challenging, but also how we navigate through the internet to find the support that we need can be quite difficult too. For some people, going straight into a web page where they get all the information about domestic abuse can be too much. For other people, that's exactly what they need and what they want. For some people, they want to access support in their own language. Sometimes we can't offer that as individual services. So we're really fortunate to be able to say that we've launched Safe Spaces Online, initially with Parcel Force and Royal Mail, and with a number of other online businesses coming forward over the next 6 months. And what Safe Spaces Online is a direct access through the public-facing webpage of named brands, such as Royal Mail, eBay, ASOS, and so on. And what it takes you to is a flat web page, one that is safe in that you can have a quick exit button. It doesn't record in your history or in your cookie type of way of examining it. It is available in so many different languages, which is absolutely phenomenal for something like this, and provides the direct telephone numbers for the 4 nations domestic abuse helplines for anybody who's a man and experiencing domestic abuse, and also provides a strong list of other websites which you can access without clicking through on this web page. In addition to that, it has a national directory of local domestic abuse services provided by our Bright Sky app, and has a self-assessment questionnaire based on the Safe Lives Risk Assessment. Because one of the things we know is that if you're enduring domestic abuse, you're looking and you're questioning and you're examining the relationship that you're having. And sometimes there's an opportunity to not only speak to friends, family members, of colleagues, but also to do a little bit of research on your own accord if you can. So all in all, we're quite, we've seen actually how we together with both big businesses, smaller community businesses such as pharmacies, but also looking at the very many different opportunities that we have, is to bring people together to increase those pathways to support. Ultimately, what we're saying is to as many people as possible is, if we are able to be those people who can believe, who can respond by listening without judgment, and that we're able to refer to specialist support services, we're reducing the number of times a victim or somebody who's enduring domestic abuse has to tell somebody else. And the sooner we can enable someone to link in with specialist services is absolutely instrumental, not only to their safety and well-being, but also to that of their children. And pretty much, thank you so much. I know I've only got a couple of minutes and I probably whizzed through that really, really quickly. But ultimately, if you're interested in either the little bit more information about Safe Spaces Online, or you'd like to get involved with popping the page up via your internet page, do get in contact. If you're interested in some of the feedback and the survey which will come out of Safe Spaces, the pharmacy response, that should be released a little bit later on. And a big thank you to Tyrion and Chris for being able to navigate through all of that data and create some level of reports. So we're really chuffed with that. And Ultimately, Bright Sky is available to download for free. We have a new app that's coming out very shortly. We're in testing phases, in which we've worked with IPPO from Respect, which is called Responding to Abuse for Employers. And we have a national helpline, which we've launched just last week, well, actually a week and a half ago, for those that are in employment and are concerned about somebody who they work with. You can contact us and we'll provide lots of different advice and suggestions, but most importantly, how to link that person with the specialist support services which are available. So thank you very, very much. And thanks for letting me take part in today.
Oh, thanks, Lyndsey. That was wonderful. Thank you. I've often said and still think that a brilliant idea is something that nobody has thought about before. And once it's pointed out, it's so obvious. And I think that would be true of the Safe Space scheme, actually. I think it's such an obvious thing to do. Why didn't anybody think of it before? It's really, really good to see that more people have been getting involved and that people within employment are using that as an opportunity to get help as well. Perhaps not the original intention of the scheme, but it's clearly working. And thanks, Neil, for pointing out that 1 in 4 pharmacies are now facilitating the Safe Space scheme. So it's obviously been a really successful scheme. Thank you. So now, without any further ado, I'm going to move to Rose Lewis from Sister Space. And Rose is going to talk to us about the challenges Sister Space has faced and also the experiences of women from African heritage. Thank you.
Hi, good afternoon, everyone. And thank you to the other 3 speakers. Amazing. You've made my job easier because you've touched on so many points that that was going to talk about. My name is Rose. I'm from Sister Space, which is a specialist African heritage charity working with women from Africa and the Caribbean, domestic violence, domestic abuse and sexual abuse. We're based in Hackney. Currently, we are in, I'll just do this briefly, in a dispute with Hackney Council over what we call getting a safe space for Sister Space. The last location we were in is a 1-room kind of shop front, which as a new charity we needed to get off the ground, but there were a lot of failings and a lot of problems with the venue we were at, and so we were moved to a temporary location. And during the COVID, we were asked to go back to the prior space. And we said to Hackney that we can't move during COVID. At that time also, the government had stated that they call it the BAME community, but we don't subscribe to BAME, which is the Black minority ethnic. We don't subscribe to that at all, because it's just throwing everybody in one pot. So they said that we had to go back to that space, and we said, well, we can't go back because at the time the government had said that the African Caribbean community was and had a high risk of COVID. And so we were like, well, we can't go back to our 1-room space. We cannot deliver a service, etc. And we asked to stay in the temporary accommodation we were at. And Hackney said no. So we said, well, we can't go back, and that's how things started. So we are still we're still in a very big battle with Hackney. We gave numerous reasons as to why, and it was interesting when you were just talking about safe spaces, and I was sitting here thinking about the difference between the amazing work you all have done about safe spaces for women to go to, and us trying to say to Hackney how detrimental it is about African heritage women and girls having a safe space to go to. So where we are perpetrators can just, you open the door and we're all sitting there. It's like if you come into your front room, you go in there, this is where we are. And, you know, throughout the years, we've endured a lot of experiences and incidences. So whilst you were talking about that safe space, I was like, look at that, look at the difference between us fighting for a safe space and the real work that you all are doing for people, for domestic abuse victims and survivors needing a safe space. So that was that. African heritage women and girls going through domestic abuse and domestic violence, we are more or less invisible, to be honest with you. We are invisible in the statistics. We are invisible with us having our voice to tell our story about what is happening for us, about our experiences, the differences in our experiences. We all know about the discrimination, the racism, the gender bias, etc., that go on within domestic abuse, even within the services, the police, in housing, in all aspects of domestic abuse. There are all the discrimination, racism, etc. I know during COVID and the lockdown, we did hear a lot from survivors and victims who said they don't actually expect to see themselves, what's the word, represented. That was the word. And so when people have, because of what's happening with Hackney Council, when people heard that there was a specialist service, a lot of them were very surprised that you have one specifically for African heritage women and girls. And that was very good. That was empowering for them. That made things a lot easier for some of the women and girls. But again, there were also a lot of issues because it was, yes, you are here, but at the moment you're having this big fight with Hackney, and what you all are going through. If what they're doing to you, what guarantees do we have that the the borough that you're working for can be useful to us, can help us, etc. All it did for a lot of people was prove what they've always known, what they've always said, what a lot of them were unable to say, just in case people thought that they were being racist or they were being prejudiced or just being plain ungrateful. Sorry, I'm just looking at my notes. In terms of when data, the national and international data was being spoken about, again, we don't see the breakdown. And then when we are included, when the African heritage community, or as they call it, the BAME community, is included, it's like, who gave those statistics? Who gave those datas? Because we don't know. We weren't asked. Not saying that we are the authority on it, but who were the people that are speaking for us? Who says A, B, or C? Challenges. Challenges are always about our voice not being heard. Always having to have secondhand information, read secondhand information about yourself. And often a lot of it doesn't match what the grassroots community know about. Again, all that was mentioned. The whole thing about the media, which you said, who was it? I think it was Chris. I think was it? Yeah, yeah. Sorry, I'm looking at the screen and it's Chris was talking about, and that was very, very interesting. In a lot of the interviews that we did, Sister Space, there was always this thing of, we need to find an African Caribbean person's experience of what it's like to go through domestic abuse. and you're just like, what does that mean? You know, and we would ask some survivors and that, and they would be, a lot of them would be wary, because it's like, what does that mean? As we know, there's the whole thing about the stereotypes of Black women, even being in domestic abuse. You're strong. Well, you all don't bruise easily. We can't see your bruises. You know, these things come from GPs, they come from the police, etc., etc. And sometimes people just want to tell their real story, not the race story. And we found that there was a lot of that. And there's also all those barriers as well about the whole cultural, the whole thing about culture and domestic abuse. You know, we know a lot of us actually just go through it, but I've actually just forgotten what I said, because yeah, so yeah, there's all that whole cultural, there are all those cultural issues that we won't be able to go into it a lot, but in terms of the COVID and all that happening, there was a real barrier, simply because when people want to report and they want to tell things about why they are not able to do certain things, they feel that if they bring up this whole thing about culture, that they won't be listened to, that they think that people are moaning, that they're just moaning about what they're going through. And a lot of them just thought that people just didn't have the time. They just did not have the time for them. But it was important for them to give their cultural perspective so that they could be understood and they could make sense of what was going on. What is this? Yeah. So what have we been doing? Obviously, we've been fighting the council. We also do. We distribute food, and during the COVID, that was a huge step. For a lot of people who were not able to really say what they feel, what they needed, just offering food and having a little talk. We would try and get some of them to come out to actually come and receive the food, so they would get time to come out. As we were talking about the whole coercion and control, we're talking about people with big families, extended families, and so on and so forth. So as you were all saying, you had to find new ways, innovative ways of getting to get to people, to talk to them, to find out what's going on. And because of what we're going through with Hackney Council, we've had a big rise in self-referrals, a huge rise in self-referrals. That has been good, but it's been very taxing on us and the volunteers. But again, you know, that's good. It's also helped with liaisoning with other grassroots communities. That has been very, very good. In terms of impact and costs, we've had to move families and individuals. We were trying to move some of them to hotels. All the hotels were locked down, you know, trying to find safe spaces, because we don't have our own safe spaces. We don't have a refuge, etc. So, you know, there was quite a lot of challenges, but also quite a lot of positives. And as hopefully this thing is coming down with Hackney Council, because we'll be going into mediation, all the things that we want to do to make things happen in the African Caribbean community, we can get on with that. I had a lot more to say, which I had jotted down, but I'll stop there. But the grassroots, and my last word on this is the work of grassroots communities, and you all mentioned it as well, during the COVID was so important. Grassroots communities are reaching where the boroughs, the councils and the boroughs cannot reach, may not ever be able to reach. And so I want to give a big up to the grassroots communities. And there will be, I think there's going to be a wonderful, huge movement where we can also work with you all, with what you all have given. And thank you so much for making my work easier, the three of you, because you mentioned everything that that makes that whole total thing. So thank you so much. Thank you.
Isn't it fabulous when a plan comes together? Thank you so much, Rose. That was really interesting. We've had lots of comments in the chat box about the good work that you've been doing, and it's very supportive, and agreeing with you that this is a very Eurocentric way to approach domestic abuse in this country. It's always good and rewarding to know that panellists have learned from each other and that we've been able to feed into each other today. And I'm so glad that you were able to join us. I know you've got a lot going on, what with COVID and the eviction and everything. And I'm really delighted, and thank you very much for finding the space to do that. And I think I really also want to comment on, even though you've got all of this going on and all of these challenges, you still managed to find a positive, and you managed to bring that positive out. And I think that's a testament to you as a woman, and I suspect Sister Space as well. So thank you very, very, very much. So we've got about 20 minutes now for some questions, and we've had a few in the box. So quite a few have been asking for details and information about where to find out more and where to get more support. And we're going to put that up in the chat box before the end of today. So if you want to get in contact with anybody, the websites for those organisations will be made available to you, and you can contact them directly like that. So I think we've got quite a few questions, many of them for the panel as a whole. But if I could start with you, Alistair. There's a question asking about engagement with perpetrator and perpetrator engagement over lockdown. Do you feel that that's generally increased or decreased, or is it just different?
I'm going to give you a really, might be unhelpful way of answering this. And I'm going to say anecdotally, the thing that has certainly been a surprise to many has been that actually, in the main, the levels of engagement have actually increased. That people have, and interestingly, those who were in group work interventions, these would be, people who are causing harm, who were in group work interventions prior to lockdown, who were then obviously initially offered one-to-one sessions. There was actually quite a groundswell of request for organisations to go back to doing group work and doing, so a lot of, several that I can think of have done small groups online. So actually, instead of having, say, 8, 10, 12, they might have 3, 4, 5 in a group, but still being able to facilitate some of that group process and group function, which I think is quite interesting. But yeah, on the whole, the feedback is that actually engagement's been really good. One thing I'd like to flag, it's totally new to me, and it's worth people maybe checking out, is what's known as online disinhibition effect. And essentially that's about people who are engaging with interventions online actually making greater levels of disclosure through perhaps some of the anonymity that they feel, as opposed to in person. There isn't I'm not aware of a great deal of research about it, but a couple of people have brought that to my attention.
Sorry, what did you say it was called?
It's called online disinhibition effect. I have mentioned it actually in a few meetings I've gone to, but it's something for people also to be mindful of, because actually what you could have is be doing a group online, and you could have someone who maybe initially hadn't made a certain level of disclosure, and actually then in a very public space, you're having to then potentially manage some really significant disclosures. And obviously what we do know about one of the risks of online work is if I'm in the spare bedroom, if I'm fortunate enough to have a spare bedroom, I'm doing my session and I'm going straight, and I might be emotionally escalated, and then I'm going straight back into the home. So it's a concern, and I think we're just trying to raise that and have people aware of it, because we don't want to be in a scenario where obviously any of these interventions are increasing risk.
Yeah, and actually I think you've answered the next question about whether the groups are continuing, and I think that you've answered that. Thank you. So the next question I think is for all of you really, and it's just support for these issues. Oh no, that doesn't make any sense. So what can people do for victims or perpetrators during the lockdown and who are stuck at home? So if anybody from the panel wants to answer that. Go on, Lyndsey.
I mean, I would always go back to the fact that for many people who are enduring domestic abuse, they're very much reliant on friends and family members and neighbours to not only provide the telephone numbers and access to support, so there's pathways to accessing specialist support, but also for you to respond. You know, we launched quite early on a listening from home campaign, knowing that actually many calls to the police come from neighbours who are concerned. And often we start to feel like, should we make that call or shouldn't we make that call? And it's a difficult one to make as being a neighbour, but I suppose one of the key things you can sort of hear is that if there's an argument going on in a healthy relationship, probably you're hearing both voices. If there's an argument happening in a relationship where there's coercive control or abuse, you're probably only hearing one relationship. Only one voice, so make that call. But also just being aware that there is such a value in providing the telephone numbers for localized specialist support. Sometimes it's really difficult to phone an anonymous helpline, but it may be easier to access a local service and know that that person or that local grassroots service is meeting your needs in a different way. And you can get information about that via, you know, Bright Sky, via Safe Space online. But most importantly, just know what type of support's out there and listen without judgment. It's very rare that a person enduring domestic abuse will say, hey, I'm experiencing domestic abuse. What they will say is probably a lot of things around that. So be aware and listen and know that your role is to link them with that specialist support service.
And may I also add as well, I've done presentations with you before, and you've also in the past spoken very strongly about being kind, and being kind is actually a very good way to deal with this situation.
Yeah, okay. Don't underestimate that the human response is often one that is really important. Creating that space for someone to talk and just knowing that listening really does help. But yeah.
Okay, thank you. So again, I think this is probably for everybody. Questions here about engaging women or perpetrators who don't speak English and who don't have access to a recourse to public funds, and how that's been a challenge for you during COVID and lockdown. Alistair's gone. We leave it to the ladies. So Lyndsey or Rose, would you like to comment about anything to do with recourse to public funds? And
yes, we have a lot of single people and families without recourse to public funding, and it has been very trying, very testing during the COVID. It was mentioned before about just trying to, there's a lot of people who can't use the internet. A lot of things have to be done over the internet. Even people with their, just their phones, not even having money on their phones to get in contact with anyone. And then there's this thing with the language barrier and the language issue, which some people just don't, they need somebody with them at like nearly every stage, just to try to navigate the whole system, and just trying to apply, just trying to talk to somebody. It can be extremely frustrating, and for some of them it's urgent, but when you don't have money, you don't have enough food, you don't have childcare, you can't do that, it hinders, and depression sets in, what's the word, lack of confidence, all those things. So we find that there are a lot of priorities, and it just seems, with the COVID I'm talking, it was very, very challenging. It still is very challenging because as you were talking about the whole backlog, where it can take up to 3 months before somebody can be seen. So you've got to get an appointment, you're social distancing, you're this, you're that, you're trying to get a refuge space if you're in a domestic abuse situation, immigration, the whole of everything. It has been challenging. It has been very, very challenging.
And Alistair, I know that Respect are looking to work more closely with ethnic minority groups and people with recourse. I don't know if you're in a position to comment on that, if it's too soon.
I think that, like for many services and many organisations, it's an evolving journey and an ongoing journey, and one that I think we're on. We've certainly committed a lot of discussion to this internally in terms of how we think, how we act, how we respond as an organisation. What I would say is I think that we do also have there is an acknowledgement as well, just touching on, I think, on some of the things that Rose has brought to the discussion, which is, we have some pockets of really good practice that we see going on with people from a range of different communities. But actually, it's really challenging for organisations to develop specific or really appropriate and targeted responses and support processes for different groups within our more, wider society when the money to develop them isn't there. So actually what we rely on is the strength of individual practitioners, which, I'm very privileged. I go to a range of services and talk to people about delivering interventions across all the protected characteristics, for example. And it's really heartening to hear the amazing practice that's out there. But the funding that sits behind the development and evolution of specific targeted interventions is seldom there. And I think it seems like a missed opportunity.
Mm-hmm. Thank you. So a couple of questions now for Lyndsey. The first one is safe spaces available for children who abuse adults, for example, parental abuse? And also, is there a danger with the safe spaces scheme that perpetrators might turn up?
So the first, with regards to if it's about children who perpetrate against adults, what we're saying with safe spaces is that anybody who's enduring domestic abuse in any shape or form, you can access the National Domestic Abuse Helplines and specialist supports within that space. So it's that opportunity for you to engage with those services outside of your home and hopefully within a time that you feel safe and comfortable to do so. So yes, it's available with regards to that. Is it safe if an abuser knows? When we initially set up safe spaces, we had a couple of things that the government had set forth, for example, that there was only 2 people who were allowed inside a pharmacy at any time. You weren't able to go shopping in pairs, you had to go shopping in isolation. So there were a couple of things that were in place that really helped safe spaces in that way. Going forward, what we've been able to do is work quite closely with the providers of safe spaces, so the pharmacists themselves, and work within their in-store policies around how they can access that space. But what we have to rely on in some degree is the fact that a person who's enduring domestic abuse would only access that space if they felt it was safe to do so. So, if there was an abuser that was there, we know for one instance, for example, where somebody had been on the high street, they had just been moved into an emergency accommodation, they had been stalked by their abusive partner who had followed them or caught them on the high street. And in that moment, she had gone into a pharmacy and said, help. The pharmacy then responded by calling 999 immediately and, allowing that person to rest in the consultation room with, some food and a drink. And in that moment, the police arrived, he had left the building, security had stepped in and they caught him down the street type of thing. So there is some things like that that are in place. But again, safe spaces is about creating an opportunity to access support. And we're working alongside the government, the Home Office in particular, looking at an emergency code word scheme, and hopefully we'll hear more about that. It will come forward in mid-October from the government.
And just related to that, a question has just come in about, are the staff in pharmacies trained, Lyndsey?
Yes, so one of the key reasons why we chose to work with pharmacies directly was the training that the pharmacists themselves have. So all pharmacists, as part of their induction into their role, have safeguarding training, so very much aware about how to refer on and who to engage with if they do have something that they need to engage with. But I think the key thing is that we provided training around the identification of domestic abuse, how somebody could come in and ask you for support. So a lot of our focus has been how to manage a disclosure. And in doing that, it's about self-care and of actually acknowledging that your role is linking someone to that specialist support service. So yes, they have had training, and that training continues. We're due to roll out a series of training programs to keep the message live. But Boots, for example, have integrated domestic abuse awareness training within their training packages for all of their healthcare staff, as well as their pharmacists as well. So yeah.
Thank you. And Rose, this is a question for you. Is Sister Space only available to people in Hackney, or is it open to everybody from an African heritage?
No, it's open to everyone. We are part of MOPAC. Unfortunately, we've only got one paid worker, Pan London. But anyway, we've had inquiries from Birmingham, Manchester. We've had inquiries and from everywhere. So.
Okay, and there's another question for you, Rose, about given that COVID affects Black and ethnic minority people disproportionately to white people, have you seen an increase in numbers of people who are referring or being referred to you, and how has this impacted on Sister Space?
There has been an increase. We've had them coming to us. It's impacted us because we're going through this thing with Hackney Council.
Yeah,
it really it's had a huge impact. But we still troop along, we still go along, and we still work with it. Yeah, the impact has. We've had to reduce our service a couple of times because we felt that we were not able to give the best quality of work to the survivors, and then we had to obviously work with those that were in immediate danger. Yeah, that's basically what it is. This thing with Hackney Council just takes up time.
Yeah. And linked to that, and you may not be able to answer it, so don't feel that you have to, but there is a question about, do you know how the COVID situation and domestic abuse and ethnic minorities in the UK compares with the US?
No, I don't know. I don't know the fullness of it at all. No. Okay, I'll be honest with you. It's just we do. We'll do the basic readings, and because of this campaign that we've had lots of support and messages from people in America, and that does come up. But in terms of stats and things like that, I don't know.
No, okay. And then this will be the last question really, and it's open to everybody. And it's just like, do you have any advice, or can you signpost anybody for advice when an employee discloses to their employer that they're either experiencing domestic abuse or perpetrating it? Big question to end with.
My one would be just very simple. Take it very, very seriously what your employees are saying. Mm-hmm. Believe your employees. Mm-hmm. If you're not able to help, or you think you can't help, there are different services that you can signpost them to. Just like you just said to me just now, if you don't know the answer, don't feel that you're obliged to try and. Mm-hmm. And be honest and just say, you know what, you probably need more language help or something. So we will signpost you, we will guide you to these people. And then if not, you just make a list. If you have to make a page list of services that are available, do so. I think you will gain more respect from your employees than fobbing them off. That's what I think anyway.
I mean, I would echo Rose. I think that's a perfect response, is that you have to listen. Believing them is so important. It takes a lot of courage for somebody to tell you as an employer that this is happening. It has obviously an impact on you know, the work face that we all put on when we come to work, and future employment opportunities and all of those spaces. But you're often a beacon in the middle of a massive dark cloud. And if you can offer those specialist support services and you can provide the routes to access them, sometimes it's about using an office in your building. Sometimes it's about saying, use the office telephone number, make those calls. Sometimes businesses can go a couple of steps further, you know, having a strong domestic abuse response policy, having guidance for how to respond, thinking about like paid leave, bringing forward advancements in salaries to enable people to think about leaving. Obviously, we've barely touched on it today, but there's also the impact of economic abuse and how that can prevent somebody from being able to leave. And I think, and I'm sure Alistair will perhaps support this, is that for those that choose to abuse, actually knowing that there is support out there and you can phone a helpline to say, I'm concerned about my behaviour, is absolutely crucial. But yeah, I'll hand over to Alistair to answer.
Yeah, I mean, I think, you know, that need for employers to have a policy and a framework around how they support those who step forward as survivors and those who step forward as perpetrators, and being able to signpost them is absolutely essential. I mean, I think when we have this discussion, my head comes back to that Home Office report saying, you know, the cost of domestic abuse in the UK is £66 billion a year, but only a fraction of that is actually the actual immediate costs. And we've got some 46 billion a year, I think, which is lost work days, lost promotion opportunities, predominantly experienced by women. Yeah. And, you know, if you want to speak another language, you look at the financial impact of this and the financial impact for employers of not getting that level of support right. You know, I think it just comes home to just how essential it is that employers, who can often be the first people to identify this, maybe a colleague at work that you confide in, are so central to potentially the right response that actually can save a life.
Chris, do you want to say anything about working with students who might disclose or anything?
Yeah, it's something we're aware of at LSBU, and we have services in place for our students in relation to domestic abuse. But it's an interesting one because of our students and their movements and where they're at and how they can best access support. So it's certainly something that's really, really important, I think.
Thank you. So it's 2 o'clock. We've hit the wire. This is it. Just to say thank you, everybody, for coming and taking the time out today. We've had lots of positive feedback in the chat. It's been really interesting. One of the best things that they've been to. So I'm really pleased to say that. I'm delighted. Thank you, everybody, for your time today. I know you're all really busy, and I know it's difficult for you to find this time, and I can't thank you enough. So before I go, just to let you know that Chris and I are organising another event on the 3rd of December to mark the 16 days of activism of violence against women and girls, and the topic of that is going to be technology and domestic abuse. So we hope very much that you'll be able to join us then. Thanks again to everybody for taking part, and have a lovely afternoon.